Hey, Christina. So Christina is a designer and researcher who focuses on understanding and conceptualizing technology experiences that support health and wellness among older adults and individuals with disabilities. Her research seeks to find ways to employ design as a catalyst for health equity and socially responsible technology experiences. She explores concepts of health through community-based participatory design and co-creation, considering health management as a socio-technical experience. Through participatory research methods, she explores constructs of empowerment and access among vulnerable communities that have been marginalized along multiple dimensions of identity, such as race, age, ethnicity, income, and class. She's also assistant professor in the College of Computing and Digital Media at DePaul University in Chicago, and the director of the Equity and Health Innovations Design Research Lab. I'm not very good at reading bios off screen, so I'm pretty proud of myself for getting through that almost in one go. Just wanted to say from Kaylee and I, while developing our own projects in the Health Design Lab, working, as many of you know, with predominantly older people, both Kaylee and I found Christina's community-centered research super inspiring over the last maybe 18 months or so, as we discovered her work. So we were delighted when we had the opportunity to invite her to speak at Dementia Lab, and really excited to have her here today. And with that, I'll pass it over to you, Christina. Oh, you're on mute, sorry.
Oh, all right, let me get set up. Okay, cool. Thank you so much, John, for the introduction. I really appreciate it. Saying sharing is paused. Are you all able to see my screen?
We can see the front page of the PDF in Acrobat, but it's not full screen yet.
Did it just move?
It didn't.
Okay. All right.
I said to Christina, we had a fantastic talk last night from Carolyn. We enjoyed it so much we didn't realize until 5 to 10 minutes in that the slides weren't moving.
Let's go back to the way we were originally doing it.
Oh, we have some feedback from the chat. You have to be in full screen in Acrobat before sharing it. Perfect.
Yeah, full screen actually wasn't working. Are you seeing this? You're seeing the first slide now?
We're seeing moving beyond accessible.
Seeing the second one?
Yeah, that works.
Okay, perfect. All right. So again, John, thank you so much. Apologize for the technical difficulties. Yes, I am a professor in design and still do not know how to work Adobe and Zoom at the same time. So that's what you have to look forward to for those students who are attending. But I'm actually really excited to be here today, and I appreciate the invitation from Kaylee and John. I've always appreciate learning about different communities that are working at the nexus of design and health. So I loved finding out that there's an entire group out there focusing on learning about, considering, and even designing for the dementia community and individuals with differing abilities. So a little bit about myself. I am a designer, a qualitative researcher. I'm a sci-fi enthusiast and a DIY crafter. I have studied all things design for over a decade now. And although my research doesn't focus specifically on the dementia community, I am in a neighboring community, which looks at how we consider aspects of older adults' identity and the tools and the environments that we create. So I'm hoping that this talk will help to share some of the insights about my interests in design and health equity and how they intersect to think about who is being considered when we conceptualize these tools and systems, and how we consider the needs of certain communities in the things that we create. So for most of my career, I have looked at the ways that older adults interact with technology, examining everything from types of use to impacts on daily life, experiences with gestures and interface, as you're seeing in this image here, of an older man standing in front of a television screen and an Xbox Connect 360 where he's waving his hand in front of him. And even the ways that technology might elicit certain behavioral responses from this group. I've taken the past several years, however, to examine these questions specifically in the context of Black and Brown communities, because in many instances when it comes to health, these communities are typically left behind. And all of this has drawn on the premise that design can be a catalyst for social change at the margins and well serves the current challenge that we face of health equity within the United States and other countries. My research explores the relationship between design and health equity. And when approaching health equity from the lens of interaction design, we actually position design as a tool to elicit change towards more positive health outcomes, whether in the ways that services are accessed, the way information is understood, or the ways people are able to experience tools meant to support health and well-being. This is an area that needs our attention now more than ever because of the ways that health inequities plague certain communities in the context of the United States and other countries, and what this means for quality of life and expected lifespan. So I always like to start with this image whenever I'm talking about designing for Black or Brown communities, specifically regarding health equity, because it really exemplifies and shows us that what we know about the US healthcare system is that it has failed poor Black and Brown folks. And we know that this is not only by design, but that design is an approach to circumvent this huge global health challenge. Specifically, ethnic minorities and low-income individuals experience health disparities at a much larger rate than that of the population majority, but are often focused on much less in the design of technology solutions to address health. As the natural process of aging presents health-related changes, additional barriers emerge that impact the ability to self-sustain health maintenance, such as things like lack of access to transportation, restricted incomes, and one of the larger challenges that I've begun to really want to look at and consider digital health literacy and digital skills. Oftentimes when we think about these challenges, when we think about the companies or the organizations that are addressing them, we hear this phrase of human-centered design being thrown around a lot, and kind of being that catch-all net that's supposed to help us solve these problems, the methodological approach that's supposed to lead us in the right direction. Human-centered design has become the trend in healthcare tech. It situates to make systems usable and useful by focusing on the users, their needs and requirements, and by applying human factors, ergonomics, usability knowledge, and techniques to the ways that we address problems. Human-centered design draws on cognitive science and industrial psychology that enables practitioners to focus on developing solutions built around the user. And while human-centered design has helped us to better understand usability variables that increase performance and system output, we're finding that it is less concerned with how technology and systems are experienced by users at the margins that may have constraints outside of traditional methods and measures of usability and accessibility. As more and more technology emerges to address health and wellness, we're seeing that health tech has started to create its own form of the haves and the have-nots because of who is centered in design research, leaving those who may be less technically savvy or digitally literate behind. And so, according to the Digital Equity Report of San Francisco, many older adults have lower digital literacy and proficiency, despite healthcare being one of the huge areas in technology development. If this is the case in one of the United States' most prominent tech cities, we can imagine that this is probably greatly exacerbated in cities where people have lower broadband access and where the median income is lower. In many of these cities, phenomena such as the digital divide play a huge role in who is able to interact with the digital health solutions that we design. Yet, how often is that a consideration when we conceptualize how to address health challenges through these digital interventions? Ultimately, human-centered design is not enough. Even in sectors of design that promise to focus the user over the system, we're still not doing enough. Human-centered design does not address the lack of equity and access to digital resources that we're seeing now, nor does it really consider how the intersection of race, class, and ability impact the ways that individuals experience healthcare technologies. So conceptually, I like to think that my work challenges the ways that we think about technology access, expanding it beyond just physical and sensory accessibility to also think about how inclusive design and technology is to those who with varying values and lived experiences. What are the ways that we can support individuals from different socioeconomic backgrounds who may reason about their health and technology differently? And so at the beginning of my presentation, I had up a slide talking about thinking beyond accessibility and kind of driving towards the margins. So who are the margins that I'm describing? Well, the forgotten middle, as it's often referred to, are older ethnic minorities that live at or below the poverty line. When we talk about designing for marginalized populations or vulnerable populations, this can often mean various things in the context of human-computer interaction and design. While the older population continues to grow, Black and Hispanic elders who sit at or below the poverty line are often not proportionately present in our research. Um, and furthermore, oftentimes when we're thinking about designing for health and aging, we're primarily focused on defining users in a very biomedical and metric-based way, either by the impairments or their disability status, and measuring how much one status impacts their ability to function on their own or interact with technology. All of this reinforcing a very negative perspective of what it means to be an older adult. This approach frames health technology needs by understanding the ways that age-related impairments impact technology interaction. Based on evidence in the literature, we know that the normal process of aging changes physical and sensory capabilities and can impose certain limitations, suggesting that technology should shift more towards these needs to best support older adults' interactions. However, what we know less about is how health and health maintenance is envisioned among certain subsets of the aging population, and in what ways we can support collaborative envisioning of appropriate health solutions among these subgroups. So one of the things I've become interested in is shifting the ways that we approach health technology research for the aging population to a more positive approach, and looking at how we can leverage lived experiences and cultural values of those that sit at the margins to inform health technology design. Equitable access to resources impacts how these communities approach health management and thus their perceptions of health-related technological interventions, making it critical to understand health needs as defined by these populations and the ways that they envision solutions. Researchers examining health equity and ways to design systems to address health disparities acknowledge the benefits of community-based participatory approaches to health technology research. So more specifically, considering participatory engagements as a feasible approach to understanding health values and priorities, we see that CBPR, or community-based participatory research, as a methodological underpinning or a framework, is commonly used as a research technique in public health, and it situates a particular community of individuals at the focus of the research itself. So at the focus of the health research, at the focus of the design research, employing both knowledge sharing and activism as forms of health intervention. Situating design within community-based participatory research is proving to help draw out health values, priorities, experiences. It also provides us with diverse perspectives on disparities, access to resources, and available platforms to position and advance community needs. Within the context of, my research, conducting community-based participatory design negotiates both the technology and the method. So we get to consider not just what the solution is or what the thing is that we're putting in people's hands or that we're building up in people's environment, but also what is the method that we use to get there? How accessible and how inclusive was that method? Who are we including, and what are we considering about their experiences in the ways that we design? So the image that's actually in my backdrop of my cover slide provides background and context to this area of design that I've become very passionate about. This is actually an image of 51 Futures, which is an example of a community-based participatory design project in the south side of Chicago in the neighborhood of Bronzeville, where designers have taken a step back to allow the community residents themselves to lead conversations on futuring. Understanding what are some of the things that we envision for the future of our community in regards to equity, policy, community, food and nutrition, development, relationships. We're seeing now with projects like 51 Futures, as well as another project, the PAC project by Stephanie Dinkins, what it means to engage the Black community in technological design or in considering what their futures are going to be within the context of their community. So thus, my work and one of the projects that I'm going to be sharing with you all today is guided by the question, how can we think about community-based participatory design as an approach to designing health-related interventions for communities that are often left out of design conversations? The project that I'm going to share with you very briefly today is an exploratory study that looked into the ways we can envision health tools with individuals within the context of their community. So I sought to look at the design workshop as a mechanism for exploratory and generative research on designing health solutions. And exploring the use of participatory research methods and collaborative design to elicit health priorities and identify directions for technology to support marginalized communities. So I went into this project with two major research goals. The first one, to understand concepts of health, health tracking, and health maintenance among Black elders. And the second, to understand how community-based research can elicit priorities, experiences, and accounts of health. So again, thinking about how can we investigate both the technology and the method within these projects. As a part of this project, in order to approach this from a community-based participatory research stance, I did a lot of community building prior to ever beginning any design. And so this was months of establishing partners with the community organization, Renaissance Collaborative Senior Village on the south side of Chicago, attending community meetings, volunteering with their plant sales and for their bingo nights and coming to their cooking nights, and really just getting to know the community in order to best understand how to approach the research, because I felt like that sequence made a whole lot more sense than doing the research and finding out about the community way after the fact. Following those months of relationship building, I did a set of exploratory interviews where I asked people about their concepts of health maintenance, how do they go about maintaining their health within their home. We then did a series of design workshops and then follow-up interviews. This was in the context of Washington Park in the south side of Chicago. For those who are not familiar or who are not residents of Chicago, this is actually one of the most medically underserved neighborhoods in the United States, despite the fact that it sits literally at the doorstep of one of the most major university hospitals, the University of Chicago Hospital. To go in depth, I sought to look at the design workshop as a mechanism for concept generation and designing health solutions with Black elders. So I designed a series of co-design workshops over the course of 5 weeks. 5 workshops over the course of 5 weeks with 13 Black older adults from the Washington Park neighborhood. Over the course of those 5 weeks, community residents engaged in various aspects of the design process to both define and address some of the issues that they faced with their health. Beginning with week 1, we did collaging concepts of health and wellness, defining what is health maintenance, what do I need to be healthy. Going into week 2, we did card sorting, at the end of week 1, individuals were given disposable cameras to do photo voice, where they went out into their communities and took pictures of what represented health to them. And then in week 2, we did card sorting of those photos, where individuals were able to share out what are some of the things they took pictures of, what meaning does this have, and what categories are we seeing emerging. In week 3, people defined what are some of the challenges that were seen in those photos from week 2, using the how might we method that has been defined or has origin from IDEO. So for example, some people listed challenges such as how might we provide fresh produce to our senior center? How might we reduce the crime in our neighborhood? And then in week 4, individuals actually started to ideate solutions to those how might we's. They defined, well, what would a system for providing fresh produce look like in the context of our neighborhoods? What would we want to see? And then in week 5, the group picked 3 of those solutions from week 4, revamped them in kind of these paper mock-ups, and shared them out with the larger group and had a discussion. And so despite, as I mentioned, going into this kind of with a focus on health tracking and understanding personal health maintenance, one of the things that we saw was an emphasis on the concept of health as a community practice. Environmental conditions such as the upkeep and sanitations in the building and in the neighborhood, having more accessible community resources, and issues of safety and community support. And so the quote on the screen, which reads, "We want a broader perspective of health in general and not so much focused on the individual, but on the people around the individual." That means family, that means the neighborhood, that means more than just an individual. Really kind of frames the ways in which discussions of concepts of health and health needs focused on community health as a priority that participants felt is often neglected in health technology research, whereas there's an overemphasis on health as just being solely the responsibility of the individual. Sharing out some of the 3 mock-ups that came out of the 5 co-design workshops. The first one, we actually had some of the Black elders of the workshops to actually mock up a petition to kind of petition for better environmental living conditions within their building and their neighborhood. So they actually came up with a list of items that they wanted to see happen. And what we learned following the workshops was that they actually took this petition and got it signed by all of the members in their all of the residents in their building, and then took it to their resident organizer and their neighborhood alderman to petition for these changes. And actually, we're starting to see some things get changed weeks after we had completed the workshop. The second thing that was mocked up was a paper medical journal to communicate with medical professionals. the Black elders that participated in these workshops actually felt like, instead of, throwing another technology at us, that we're not going to know how to use, or that's going to be frustrating, or that I'm not going to be able to keep up with, I would like a really well organized medical journal that would allow me to write down what I'm feeling each day, what are some of my symptoms, um, what did I eat? When did I go to bed? So that when I go to the doctor's office, I can kind of just bring this with me and have this tool to communicate. And a lot of this spoke to some of the conversations that folks were having about, I don't really think of my health in terms of metrics that a lot of these apps collect. I think of my health very subjectively. Do I feel better today than I did yesterday? Am I able to walk further today than I did last week? These are the types of things that I would want to track, and I don't necessarily want an app to do that. I would rather just use a journal. And the last item that participants mocked up was drawing of a vending machine, which would supply fresh produce and medical supplies. A lot of the elders that participated in the workshops felt like, I'm not able to, get aspirin or Tylenol or even fresh fruit in a very convenient way, because of where Washington Park sits. Because there's no CVS or Walgreens, I have to go to a neighboring neighborhood to find these things. And so one of the technological interventions that they felt like was necessary was actually to have a vending machine in their building that would allow them to have access to those things. Another major theme that emerged from this project was understanding that empowerment towards health activism as a result of engaging in this series of participatory design workshops. This is particularly interesting for marginalized populations, where there tend to be several barriers that impede individuals' ability to navigate their health. The nature of engaging participants in community-based participatory design research afforded them to not only feel ownership over the ways in which they engaged in the workshops themselves, but it also elicited a dialogue and examples of solutions that were tied to them owning the health conditions in their communities, or kind of taking that ownership and not having expectations of city officials or local governance to do those things for them. So the image that we're seeing on the right-hand side of the screen here is one of the ideation sheets that came out of week 4, in which an older woman is holding up a telescope, and the how might we that it is addressing is how might we reduce crime in our neighborhoods. And so the discussion around this was, the woman felt like, being in the south side of Chicago, we see a lot of violence, and there's a big concern for our safety, and that does impact my health at my age, because I'm older. I'm not able to drop down below windows whenever we hear shooting as quickly, and so these things are important. So one of the ideas that she had was, I'm going to stand on the roof of our building with a telescope. Whenever I see something happening or something of concern, I'm going to call down and let people inside the building know, so that they can get to safety. Because we, for so long waited on police, tried to rely on 311 or security guards that have been, that are no longer funded for our building. Now it's time for us to take this into our own hands. And so ultimately, some of the considerations that came out of doing a project like this are, as well as considering community-based participatory design as another site or approach to doing design work with individuals that fall at the margins. We also see that design workshops can support community health activism. Just kind of the premise of getting folks together who are situated in a similar geographic location, who are able to identify commonalities in the ways that they live and the experiences that they have, kind of led to, as we saw in the last slide, folks saying, you know what, we're going to do something about this and change this, and no longer just have expectations of what we want to see happen as it being out of our control. Secondly, understanding that individual lived experiences and cultural values actually frame the ways that they see health, as I mentioned with the health journal, and thinking about, this is actually the way that I conceptualize my health. It might not be digital in this sense, it might be more analog. And here's how I would want to address that. Here's the tool that I would want. Also thinking about community and collectivist approaches to health information sharing may also be an opportunity to impact health and digital literacy. So just coming together and sharing tools and resources and thoughts and ideas may be its own way of disseminating or sharing health information and learning about different things that individuals didn't know prior to the design workshops. Um, So going back to that original premise in my title slide of, well, how do we center the margins in design? One of the things that I really love that John started this presentation with, or this keynote with, was a land acknowledgement, and thinking about the history of, where some of our universities are situated, where some of our design organizations are situated, where we do the work that we do. And so the number one thing is centering the history and understanding of Black, Indigenous, and Latinx folks in the design process itself. If we understand the history and the potential harm that has impacted many of these groups, we can better understand why certain methods may or may not be appropriate, why certain tools may or may not be feasible, and why we might need to approach design in a completely different way. And that leads to shifting to community-driven design and not just community-based design. Understanding what the community wants to see. As we saw with the 3 outcomes that came out of this project, a lot of them were, as I mentioned, analog. They were not overly technical solutions. And this is actually what the community wanted as an outcome, what the community felt would best support their health on a day-to-day basis, and the community's health on a day-to-day basis. Initially acknowledging new measures for data practices that eliminate harm outside the confines of this project specifically, but thinking about the ways that we collect data and what we do with that data, and how potentially those things might be more harmful to certain communities than others. And lastly, centering equity instead of equality, giving communities what they need as opposed to giving all communities the same thing. And so when we're thinking about, that intersection between interaction design and health equity, it really has to be about the equity piece, right? It really has to be about, what does this community need to be able to maintain its health, instead of just, what can we give this community that other communities already have? And so considering, well, how do we implement this in practice, whether it be industries or nonprofit, considering how research instruments are standardized and developed, considering recruitment may require intentional community or intentional engagement with the communities that we're situated in. This also goes for university research settings. What ways are we engaging with the community outside of just asking them to participate in our research, outside of just asking them to test a device for us and going back into our labs? And ultimately, that brings me to shifting how research participants are engaged, to consider them as research experts, right? A lot of these people are experts of their own lived experiences. They're experts of the neighborhoods and the cities that we have often moved to start that job or to start that academic program. They know way more than we do in the context of the questions that we're asking them. And so considering this and compensating them as such, hiring people as a consultant, just as you would for a design project, and paying them in ways that really compensates their time. So I wanted to thank you for listening to me ramble. You can feel free to, I think, put questions in the chat, or I don't know if we're going to take them verbally. And I've put up, if you don't have a question at the moment, or you want to keep track of some of the things that I'm working with the EHI lab, or to reach out, I've put some contact information up on the screen.
Thank you, Christina. Fantastic. We're going to do both verbal questions and questions in the chat. So just to mention what I said at the start, if people are comfortable asking their own question, you can just put your name in the chat and I'll come to you. Or if you'd prefer me to read it out, you can type it in there and I'll read it. I actually have a question, Christine, just while folks are typing their own, I'll just take the opportunity. I think it's like super interesting, the idea of centering the margins within the design process. And I think what's really interesting in terms of where you're positioned as both an educator and a designer, how much do you think design school has to make that change, to shift that kind of approach? Because a lot of what we teach is of obviously kind of problematic and from a singular perspective as well within art and design. How do you think design educators need to perhaps question their own methods and to be more inclusive?
Yeah, I think that's definitely part of it. I argue that it's not just design research, it's design as a field and a way of thinking. I think that we, you know, have started kind of this exclusion in the ways that we think about design, that we are the gatekeepers of the knowledge, instead of considering that design is actually inherently a natural way of thinking. When we go about our day-to-day lives, people that don't study design or people that are not in some type of design career are problem solving every day. They're coming up with ideas every day, and they just might not be thinking about it in the way that we do. They might not have the formal training of what to do with those thoughts in terms of how to conceptualize them or develop them, while some do. But I think we have to start challenging this notion that design is this elite thing that only certain people are able to do, thus only certain people should have access to. And that's a lot of what I'm finding in the work that I'm doing, because even with this project, I had some of the older adults, when it came time for week 4, they were very hesitant to put pen to paper and sketch things out, because they were like, my brain doesn't work like that. I'm not a designer. I didn't go to college. I didn't, for some, I only have a certain level of education. But it's like, yeah, but you know what you need better than anyone else. And you've come up with ideas all the time, right? And so I think kind of dismantling this concept that design has to be this privileged or elite activity within the confounds of sticky notes and offices with whiteboards, right? And if nothing else, we're learning that in this moment within the pandemic, where we're not able to gather in the big fancy offices with the glass windows. We're having to say, how can I go back to the roots of communicating design in other ways that don't take a lot of these fancy tools. And if you're able to do any type of community-based design work right now, you're having to simplify things all the way down to the most analog of methods to be able to engage with people over distance.
Mhm. No, I think that's great. I think one of the things that a lot of us have learned teaching online is that it's mostly about that human connection, right? It's
Mhm.
mostly, I think people, doesn't matter about where you are or what tools you might have in your
Yeah,
hand. I also thought it was interesting how you mentioned activism at the start. Some activism might inspire some design, and then actually some of the outputs of the design are
yeah,
activism. Actually, maybe people who don't consider themselves designers can maybe more comfortably see themselves as activists, people who can
yeah,
maybe community organized as a community to make a change and not even consider it as design.
exactly.
Mm,
Exactly.
fantastic. I'll stop talking so other people can ask questions. I'm just going to go back.
I see a couple of great questions in the chat. I don't know if we want to.
Yeah. Let's go to Myrna, because I think Myrna got in there first. Myrna, do you feel comfortable reading it out? And you're a healthy contributor to the other
I
sessions.
do, but I just put a mouthful of cereal in my mouth. However, I'm finding that that going to the people on whom we're concentrating on, going to their communities is much better than having them come to you. And I see that as a major shift. And I want to know, Christina, did that really make a difference in how you were able to get more information?
Oh yeah, definitely. I think one of the values of this approach to design and design research is that it allows you to kind of structure the project itself um, around what is most comfortable for the individuals that you're engaging with. So, for example, with this project, um, doing the length of community building that was done and designing the workshops to be held in the community center itself allowed for us, and I worked really collaboratively with my postdoc advisor at the time, Anne Marie Piper, to kind of figure out, okay, how can we design these workshops where they already kind of mirror the ways in which these Black elders are used to doing community activities. So it's, not disruptive. It kind of brings them into thinking in a ways that they're already used to. They were used to, doing community activities in their health and wellness room is what it was called. They used that room for the cooking classes, for the plant sales, for a bunch of different things. And so in addition to kind of alleviating the barriers of, transportation, of them having to come to our university lab, and people having to take the bus or the train or whatever the case may be, in addition to alleviating those barriers, we actually also kind of helped to formulate activities that flowed into their daily lives, right? We found a time, like, we picked a day of the week that was open, but a time slot that was typically used for activity hour. And so we were coming at Wednesdays at a very particular time where, Tuesdays was Zumba and Thursdays was TV time. Now we just kind of added another slot. And it kind of really worked. And granted, not all researchers or students are going to have access to be able to do that. But because we were privileged enough to be able to go to them and kind of structure the project in that way. There were additional benefits, and definitely something that I would recommend if you have the means to do so.
That's an amazing answer. I'm also thinking that there may have been people that were watching sort of from the extreme part of the area, so they still got something out of it, although they weren't really involved. Thank you very much, Christina. Great talk.
Thank you.
I was going to say, Christina, do you think the success of the project was partly down to the fact that you gave something to them prior to going in and working as a designer? Because we have lots of students in the room who are currently working on their thesis project, and often there are proposals. I'm going to go and I'm going to give my knowledge as a designer, and these people are going to be really grateful for that. Or actually, more often than not, the person who really benefits from that kind of interaction is the designer, is the
Yeah.
academic. How much do you think the project benefited from actually you just going in and becoming an active community member?
Oh, a lot. I mean, more so, less about the research and more about the rapport, more about the comfort, because I think, you know, doing health design research, even though it's design, health is a very intimate topic for a lot of people. And, there's oftentimes a reluctance to open up about, some of the health experiences I may have had. Some of my certain conversations might lead me to talk about my surgeries or hidden illnesses or disabilities that I might not want other folks to know. Building that rapport helps us to get people to a place where they want to have those conversations with you, and they want to have those conversations within, the physical setting of others. Because there's a little bit more of a relationship there. There's also more, the time that I've spent engaging with Renaissance Collaborative, uh, was flowed after the end of this project. And that to me is more about the investment in the community, because I see one of the questions in the chat was like, well, if we lack a budget to pay people, how are we compensating people? One of the things that I developed during this project was creating community newsletters that had different digital skills from questions that people asked me during the workshop. Because if you've done research with older adults, you know that oftentimes that research is an opportunity for them to ask you about their phones, about things they saw on their computers. Do you know this about this device? And so one of the things that we did was to say, okay, well, we know that out of this work, as an academic, my social currency is to write some paper, but you're probably not going to read that paper. So how can I take the knowledge that came out of this project and present it back to you in a way that's meaningful, that you actually care about? So we started, it started with just a one pager of like, here's what you guys did, here's what you all talked about, here's what we learned, here's what we're thinking about doing with it. And I had this luncheon, and they got these trifold one pager printouts, and we got to have this discussion. But then people were saying like, oh, what would be really great? We talked about this during the workshop. I don't know how to look that up on my phone or to do that on the computer. That would be really great. So now as a faculty, the EHI lab, we have a quarterly newsletter that we put out that talks about, hey, did you know Zoom is a way that you can, engage with your family members. Here's how you can get started. Here's some of the cool things that you can do. Here's some of the cool things that you can do with your phone, in context of your health. It actually tracks your steps. You don't have to do anything. If you go into this and that, like we present out that information, and that's its own way of supporting the community. We also cull together all of the community resources, particularly once COVID started. We were able to cull together all of the food distribution, and here's who is helping to give out masks. Here are the stores that have senior hours, so that you can go in and get supplies, without having to literally fight people or be trampled. And we put all of those things in the newsletter, and printed them out and had them delivered. And those are also ways that you can support the local community, even if you're not able to pay them, with some large budget.
Totally. Thanks, Christina. Just going back to the questions. We have a question from Anne. Does it create extra challenges to address conditions that are stigmatized in given communities?
I mean, always. But I think we were just lucky enough that folks wanted to talk about certain things. I think that in some instances, what I found is that communities that are stigmatized, not just because of the disproportionate health inequities, but also, because they've typically been neglected in this type of research, or they might have had negative experiences with this type of research. They actually wanted to just unload about everything that they've experienced. They were like, here's our history with this university hospital, and why, this is really important for you to be doing, and some of the things that you need to consider, and whatever the solutions are. Again, thinking about both the technology and the method. Here are some of the ways that you need to shift the ways that research is done, because in this approach, it has become particularly harmful for Black and Brown communities, and that's never thought of when these university hospitals come in to try to do their research studies, or when students come and try to do their semester projects. So although again, we're talking about very intimate conversations or intimate topics, we were just able to, I think, figure out a formula where we were able to tap into people wanting to be really transparent and really open.
Can I ask, Christina, in the current COVID context, how has your research approach changed, and have you responded?
Yeah, I mean, so for this particular center that I work with, it has just really been more about supporting them. I have not been actively doing any particular study with them. More so, like I said, we've been developing these newsletters that we're putting out to help with different things, because this is a center that most people do not have access to a laptop or computer. So, thinking about how we might do remote co-design work with them is still kind of a challenge. And also just not the priority. you know, and so that has really just been more about how do we develop tools for support. But there have been other communities that I've been able to work with at this time where you know, to kind of explore how do we do remote co-design, how do we do remote focus groups, what are the topics that matter in this moment that, you know, are going to be of most support. And also, how do we think about the dissemination of health information when there's so much misinformation flying around, has kind of been one of the major research questions I've been exploring during the pandemic, and developing tools and article forms of knowledge dissemination to support that, specifically among Black and Brown communities.
One of the themes that came up in the talks last night is obviously in the COVID context, the priority to kind of distance and to isolate, or actually how problematic that can be for many older individuals, and how important those community connections are. So the challenge for us is like, how do you maintain those things? How do you keep those kind of relationships alive, and not just kind of push people into isolation, because that can create different problems, right?
Yeah, yeah.
I can see Nadia very enthusiastically writing that she has a question in the chat.
Okay.
Nadia?
Hi, Christina, thanks so much for your talk. I just had a question about, have you found that people were resistant to like a researcher coming in, and have you found that participating in activities yourself was helpful, or is being a facilitator more helpful? I think we've tried to find that balance before in workshops, and I think it goes one way or the other for different ones, but have you experienced that?
Yeah, I think that and the reason that I was very intentional about phrasing community-driven outcomes, is because I think that I found what's most beneficial, or most valuable, is for me to take a step back and to let community lead. Because I guess I think about it in this dynamic. You're coming into a community, specifically if you're working with elders, and if anyone knows anything about working with Black elders, you know, they've been there for generations and generations and generations, and have a very particular way of doing things that are, you know, very culturally specific, and that are handed down in a very particular way. So you're coming into these communities and saying, okay, I know I am the expert and the knowledge holder, let me teach you. And they're like, well, you're asking me these questions, right? Like I know this community. I've been in Washington Park, you know, to know it, you know, when it would from the years of it being ridiculously segregated, and to know when we couldn't go to this hospital, and to know, you know, when we had to, we were only allowed to work these jobs, and so forth and so on. And so to come in and kind of an instructional perspective, or from a point of view of teaching, almost felt a little disrespectful. It was almost kind of like, okay, well, let's put a very broad topic of health and health maintenance on the table. What are the things that you want to focus on? Because some of the comments that we got back, you know, really made us realize what the focus in our field has been. I had a woman to tell me, to kind of pull me aside, and she was just like, y'all always want to ask us the negative things about health. You never want to ask us the positive things. And she was like, and getting older she's like, I'm not dead yet. She's like, I don't always want to talk about what's wrong with me. You know, she's like, sometimes I want to talk about the things that, you know, excite me about my health, or the positive things that I do to keep up my health, or how healthy I am. And I think that because that happened to be right before we started the collaging. And when you looked at her collage, you know, a lot of her imagery was like, here's how I see myself, and here's the aspects of myself that are healthy, right? Here's the things that I have been able to do. So I think that there's a fine balance of finding ways to still moderate design sessions with these groups while allowing them to be community driven. And a lot of what I'm exploring in other projects right now is like, well, then how do we work with kind of like community liaison, you know, project managers, people that come from within the organization. Within the context of this project, it was the resident organizer, right? She kind of became the liaison, or like the project manager. Every week I would meet with Anne Marie, and then I would go down to the center and I would meet with Madly, and Madly would talk to me about, you know, what are people saying about the last week's activities, or, you know, here's what we're doing. How does this fit, you know, within what you know of the center, what you know of the folks that come to these types of programs. Madly was able to say, you know, there's 70 people that come to this community center. You're probably going to see 20. Here's the 20. Here's what they enjoy doing. You know, like finding ways to work with community partners such that they're helping to, like, you know, even if it's just one person, they're helping to drive the research, or they're helping to drive the design project. We're seeing that more and more and more in HCI. You know, a lot of folks are saying we, you know, and identifying, here's how we built this relationship with the community partner, as opposed to just going in. I think we're going to see less of people just cold going into a community and saying, I want to interview you guys, right? Because communities are starting to say, who are you? They're starting to be very protective of the members of even online groups, right? Moderators are starting to say, you know, we have questions, like, what are you doing with this data? You know, how well do you know this population? How can we trust that you have our best interest in heart in the project that you're doing, and are not just being self-serving, you know, to get your paper done, or your thesis done, or whatever. So I think that relationship building is critical, and coming at it from a perspective of community driven, and kind of taking ourselves from the forefront of it.
As you enter these projects, do you see your role as a designer as more of a facilitator these days? Perhaps it's like about getting certain people within a room and certain experiences in the room, rather than maybe any kind of.
I see. Oh, sorry, go ahead.
I think I kind of finished. It's fine.
I don't know if I consider myself a facilitator. I don't, yeah, that's a great question. I actually have been wanting to take myself out. How do we take ourselves out of the room completely? Is a question that I have. And so one of the things I'm doing in my lab at this very moment is, from building up of this project, some of the other projects that I've done, and things that we've gotten published, is, you know, how do we go beyond participatory design? Because I think that even in some instances, like, you know, myself and a couple, you know, a number of other folks in the HCI and design space have and are able to be very critical and reflective of ourselves as academics and practitioners in the ways that we conduct participatory design. Like, is it truly participatory? Or to Nadia, I think was your name, to Nadia's point, is it really more of us coming in and saying, hey, I want to design this thing, and I want you guys to tell me what color it is, what shape it is, how tall it is, right? But we already know we want to design this thing. So that's not really participatory design as much as it is just getting validation of a thing that we already know we wanted to create. And so I think that in me being reflective on that, I've kind of started to ask, well, are there ways for us to enable communities to see their inherent design knowledge and their inherent design abilities with us being out of the way? Is it a toolkit, right? Are we able to, like, say, here are, you know, method cards or games that kind of, you know, take people through a process to come up with their own research questions or their own challenges that they're, you know, kind of starting at week 3 of what we did with this project, of like the how might we's, like identifying those challenges and taking themselves through the process of identifying solutions to put out in the world, and finding ways to then interact with universities or design labs to make those things come to life. And that's kind of what I'm exploring, because I kind of feel like that's the next step, right? You know, typically traditional design has been designing for. Participatory design is like designing with. How do we allow people to kind of take that helm and the reins of design to kind of start it themselves without having to rely on academics or design practitioners? Because oftentimes we're not in the room, and in many instances, by the time we get to the room, it might be too late to actually address the challenges that we want to. We know that there's like coming up with solutions for like a thesis project to present to, your design studio and get your grade and move on. But are we actually putting out things in communities that are going to achieve health equity? Oftentimes we're coming behind the curve on that. So how do we start to think about equipping design as a tool in itself to be put in the hands of communities that can do that without our presence? It's kind of what I'm thinking about.
Kelly, I know you said you had a follow-up question. I was just going to say we had that exact question that you just answered in the chat from Lisa as to how we might come together as a design community to facilitate community-driven transformative structural changes. So needed in health. You preempted the question, Christina. It's brilliant. And
Okay.
Lisa, there's nothing else to go on. But Kelly.
I feel like I have a lot of follow-up questions, and my follow-up question keeps changing as you keep talking. Christina, I think so much of what you're saying is, amazing and really resonates. Yeah, I feel like I definitely have had that experience, on some projects working with Indigenous communities where, all of a sudden now I've sort of stepped back to the extent that now I'm not really sure, like, am I contributing as a designer, and does it matter anymore? Am I just a project manager helping to use sort of my capacities in that way? So I guess that's sort of one question I have is like, do you still think that there's, like, what are the skills that, trained or professional designers still, do you think, bring or contribute, or are there any?
I mean, I think we have the tools of synthesis and documentation and dissemination, right? I think if you use the example that you kind of were sharing, like if I take a step back and I kind of watched and slightly moderated this entire design process, and then communities turn to us, okay, for like the what do we do next? And kind of using our privilege and our access to the resources that we have a lot of times, in these universities. Like there's not, laser cutters or 3D printers just lying around most community centers, but we have access to those, right?
Yeah.
And so if they're coming in, they're saying it would be really great to see an example of this thing. To figure out what it would look, to figure out if it would work now that we've come up with the idea, and we say, okay, that's where I jump in. Or if they're saying it would be really great to get this knowledge that we've discussed in this design workshop out to the larger community, right? Because as I mentioned at Renaissance Collaborative, 70 people come in and out, 20 people are more than likely going to be engaged in our activities. So when we created those newsletters, we're still printing out 70 and we're just dropping them off. If you want them, take them. What would it mean for us as designers to say, okay, well, we can create the zine that's going to go out to the larger community to kind of capture or to synthesize and capture and synthesize what the conversation was here today, and to, organize it, structure it in a meaningful way, such that people who weren't here, such that people, who still need this information can get this information at a low cost way, right? We've seen the reemergence of zines, because zines have been around, but now people are starting to apply them.
Speaking John's language now, I don't know if you know this, but
yeah, and I think they're great. Like our lab is creating one literally about community-based participatory design and how it can be helpful for design organizations to engage with the communities that they sit in. Like we're literally creating that zine to put that out, right? Because it's free, right? And that it's the when I think someone put in the chat that like technology technology can be pen and paper. Technology as a solution can also be the information that we disseminate. And so I think that those are some of the ways, right? We come in that latter part and kind of allow people to drive or to lead the initial phases of the design process.
Yeah, sort of helping to link people and resources that maybe exist that they might not be aware of. My other sort of follow-up question that keeps coming to mind is, I think I have a sense of, when we're working with a group, when we can sort of step back and let them take the lead, but I still struggle sometimes to figure out, like, how do we set up, projects or relationships, in a way that says, like, we're here and we can help, but, without like just sort of coming in and being like, we have the answers.
Yeah.
Sort of like, how do
I think that that comes in that initial community building, because I think that oftentimes what we found, and literally what drove me to the project that we're creating, the zine, what drove that project is me knowing community organizers, community health advocates, people that work on the grounds of different organizations that are outside of academia. And they'll be talking about one project, and then we'll be talking about one project, and we're like, wait, where's the bridge? Why are we not having conversation to know that oftentimes, even for a course project, we might be approaching this in a recreate the wheel type way, because there are already people that are doing this work. How can we lend the tool, the actual skill set that we have? And I think oftentimes our approach is, we are the keepers of knowledge. Let's go out there, let's collect more knowledge to create this thing, where there are people that already kind of have cultivated that knowledge. In just about, you know, every area you can imagine, there are people that have been organizing and strategizing to make something happen in their local communities, right? Whether it be, you know, economic, of like dealing with employment or housing, or political, or in the areas of health and wellness, in the areas of, you know, mobilizing. And it's having conversations with the right people to start the project, to say, what have you, and I think a really, really, really great example of this, the breastfeeding project that happened at MIT, the hackathon, the breast pump hackathon,
Yeah.
Where they literally went to community organizers that have been working in infant and mortality health, that have been working in maternal health, and said, how are you all already, you know, what are you all already working on, and how can we, you know, bring students to, and it became like this whole hackathon thing. And I thought that that was like so amazing. And if you look at the outcomes of that project, and I may be forgetting the name, I'm having a bit of a brain.
You know what you mean, yeah.
Yeah. The project has a very specific name, but I know that there were some of the researchers at MIT, Catherine, the Ignazio, I might be mispronouncing her last name, and a couple of other folks were a part of that. And I think that that was a really great way of engaging with community work that's already happening, as opposed to, you know, saying we're going to have this graduate studio course to hack the breast pump, and then it doesn't go anywhere past the course, right? We have our students do these really great things. They have these amazing portfolio pieces, or, you know, website pieces. They present. We've taught them all of these things. And then unbeknownst to us, there's this whole movement of work going on literally outside our doors down the street in whatever city we're in, focused on the same thing. And I think, you know, that goes back to number one on the screen there, of just like, not just centering the history, but also understanding the communities that we are situated in. And I don't know if that is like a course, a curriculum thing, that maybe that needs to be in design curriculum, or university curriculum. But I think that it's really important.
Yeah, I think part of it is like our expectations around the pace at which we can do things. You know, we think like, you know, I struggle more and more like talking to grad students about the work that they want to do in the 2-year span. And it's like, oh, really? You need to just build a relationship for the first year, and then maybe you'll get somewhere in the second year. It's like, you know, I keep trying to think about more of our projects as like marathons and not sort of sprints that we're trying to accomplish things quickly. It's definitely a shift in like the funding cycles and research and the way sort of we tend to want to work quickly. Thank you.
Okay, thank you, Christina. I think we're just about out of time this morning. Got a guest. If we'd just like to all unmute and give a round of applause to Christina.
Yeah.